This is the unboxing of the Bioniko models for cataract surgery. And you can see here, this is their card where this QR code will give you all the instructions and videos on YouTube. There are two kits that I have here, and in full disclosure, these are probably not complete kits simply because these were sent to me for the purposes of just demonstrating. So I think there are many more items that actually, many more numbers of each item that come if you order this kit. This is going to be the dry lab kit. This is the wet lab kit. The dry lab, is we have discussed in the past, is for the purposes of practicing mostly capsulorhexis and suturing, which you can do without the phaco machine. And so if we take a look inside here, you can see this is a relatively small footprint. So inside here, this is the solo kit, okay, for corneal suturing and for capsulorhexis. And inside the kit, we have multiple items, of which these are, modular. And so this is the holder for the eye. And we're going to go over how to use this holder simply because I've broken a few, in starting out here. So as you can see here, this holder is basically a suction cup right here, a suction cup in which you're going to place your eye items. And then the eye items here include, for this kit, a partial corneal scleral shell here to perform capsulorhexis. And inside there's the lens, and here are basically the lens samples. So these are going to be, the lens part are going to be swapped out as you perform more and more capsulorhexis practices. And this is going to be the tool that you use to take this lens in and out of here. And then this item is the cornea, the packs for practicing corneal suturing. So essentially this is a, recipient cornea with a donor button here and a pen. So this is the suturing and capsulorhexis practice set. Just trying to move those over. And then this set is for phacoemulsification. So you can see here again, it comes in a very nice transportable small box, and this is a cataract starter kit. You can see here again the QR code so you can watch the videos. And inside here, again, the foundational component is going to be this, which is the holder. So the holder in this case is an anterior vit holder because you can actually practice anterior vitrectomy by actually using egg whites apparently and injecting egg whites under here. So here's the eye holder with an injection port. And in this case, we have here, this is the corneal scleral component that we're going to put inside this eyelid holder. And then these are more practice lenses. So again, the lens is going to come out of here, and those will be replaced in order to practice phaco. So here are the Bioniko wet lab and dry lab kits. Okay, we're going to start with trying the Bioniko capsulorhexis practice. So you can see here I have the holder that we put on this platform here under the microscope. We have here our instruments, including a keratome blade, cystotome. This is just a spatula that I'm going to use to manipulate this corneal scleral shell, a capsulorhexis forceps, a little bit of lubricant, BSS, and let's get started. So you can see that this is fixated already on here using the suction cup. And in order to put this eye in, we need to be careful not to press down like this on the entire unit, or else it's going to break, but instead to pry open the eyelids in order to get this in. So I'm going to slip it in on one side like this, and then try to pry open the lids to get that inside. So you can see that that's secure. Okay, I'm going to center under my microscope. I'm going to wet the whole thing a little bit with a little bit of BSS. And then we're going to get started by making the incision. So we have our eye model, and we're going to go ahead and open the lids gently and insert our unit here. And you can see that that pops just right in there gently. And this is an open sky capsulorhexis that we're going to perform. And so first we have to make our main wound. It's unclear to me whether we can make a biplanar wound here. So just trying to make an entry. This is a 2.4 millimeter blade that's being used, and I've marked it already so you can see where the wound is. We're going to enter with our cystotome and puncture right into the center by pressing or by pointing down, not pushing down, and then coming to the side and trying to lift a flap. And you can see that that flap is quite thickened there. I'm going to get that flap to flap completely over. Well, we know we've made a flap there, so we're going to go ahead and get our capsulorhexis forceps and then grab the leading edge of that flap in order to bring that around. So as we're bringing that around, we know we have to grab it tightly here and try to bring that around by manipulating through the wound with the flap flapped all the way over. And you can see that turn in the wound there. Whoops, not so easy. And so as we're bringing it around, the goal is to have the flap really flapped over so that it doesn't go in some strange direction, especially if you pull it to the center, that's going to radialize. So you can see I'm using a lot of force here, and unfortunately I'm mangling the wound quite a bit. You know, whoops, and now we can see that there was so much stress that I've actually come straight through. So anyway, we're going to go ahead and just complete the circle so you could just see this would be the motion to go ahead and complete that capsulorhexis. One of the most important aspects of this Bioniko model is how you swap out the pieces of the eye. So as you can see here, this is the holder, and we see here the corneal scleral portion for the capsulorhexis. We're going to go ahead and take that out. We're going to assume that we finished this, and we're going to remove this. So we're going to remove this from inside here. And as you can see here, so this is, if this has already been finished, then we're going to pop this out and just push on the periphery, and that lens comes out. And so we'll dispose of this, again, assuming it was used. And this can be used multiple times. So if you make the wound and then turn this around, you can have, there are multiple uses for this. And so you'll take the new lens and you look at, this is the shiny side up, this is the dull side. So the shiny side is the side that you want to work on. So we're going to turn this over and put the dull side towards us. And then this is very important, this instrument here. So we're going to use this to then secure the lens inside this shell. So here we go. So you kind of dial this in until that's been pushed through, and now you can see that's secure. And then we're going to go ahead and start again by inserting this inside the eye. And again, we pry apart the lids in order to put that back in. And now you're ready to go for another capsulorhexis. So you can see here, we're going to try again. We're using the same cornea, which we just turned around, and now I'm going to go ahead and make this wound really at the base, the intersection of the horizontal and the vertical aspect of the cornea here. I think we need to be right at the base, and again, inserting the cystotome, puncturing right in the center, pulling to the side, and then trying to create a flap. This is a little bit, thickened compared to the human capsule. However, the point is not to simulate actual human tissue, but instead to just be able to understand the directions and the forces that are needed in order to perform these motions and to figure out how to manipulate these instruments in the wound. And so now I've introduced the utrata forceps, flapping the flap all the way around, making a big turn in the wound here, not pushing against the edge, but just changing the angle in order to get that rhexis to come around, and not allowing that to flap back over, and grabbing near the leading edge. And again, going in a circular tangential motion, not pulling centrally, but just following the edge of that circle. And you can see here, I'm pulling against the wound, but successful this time, and making the turn in order to get it to go to completion. It's not complete yet. We can't just pull that out. So now pulling the center just to make sure that we're complete. And that is a complete capsular rhexis. We're going to go ahead and change out the lens again. So it's just to demonstrate again how this works. We're going to remove this base, and in order to pop out the lens, we just push in the periphery with a forceps or with a spatula in this particular case. So you can see just gently pushing out that lens with that perfect circle that's been created, and we're going to go ahead and look at the new lens. Again, there's the shiny side and the dull side, and we want the shiny side to be the anterior portion here. And so we're going to turn that over. This is the dull side that's going to be facing us as the cornea scleral portion is upside down. And we're going to use this very important instrument to just dial in the lens. So we're dialing that in so that it's secure. And then we turn that over and then gently open the lids of the eye. And you can see it's wet, which makes it a little bit more pliable. And then gently inserting by opening the lids. And we're prepared to practice again. So this is the corneal transplant model, part of the Bioniko set. And as you can see here, this is very good for practicing suturing. We're going to go ahead and insert the scleral or corneal scleral shell of the recipient into the holder. So we're going to wet and pry open the eyelids. And then this part of the cornea, the donor cornea, has to be soaked for about 15 minutes in warm water. So it's important to prepare that before going ahead to perform the suturing. So you can see it fits here exactly. And we're going to go ahead with a 10-0 nylon suture. Oh, you can see that the button fell inside the eye. And so, no model exactly simulates the human eye. This is a little bit thicker, it's a little bit more rigid. However, the most important thing is to just practice handling the instruments and figuring out the maneuvers that one needs in order to gain enough rigidity to pass the sutures through the tissues. And then doing things like handing off the needle and then figuring out how long the sutures need to be in order to tie them. And then simply practicing these maneuvers of tying sutures. This is one of the most important things that can be practiced, and is one that I think that is often neglected, especially for those who are excited to do phaco. But this is a critical skill to have, and one that can easily be achieved outside of the operating room. Even though we are doing this clearly here under the microscope, this can be practiced using loupes, or even with a naked eye. One can see generally well enough in order to at least handle the instruments and to make this worthwhile. So we're just going to speed through the end here. And again, you can see it's about being able to manipulate these very, very small sutures and to figure out how to angle and how to adjust in order to get the sutures to go through the tissue. I think this is a very nice model, very realistic. And here's just a speeding through, obviously to get the tensions correct, to get the sutures to be very radial, to be evenly spaced, and to prevent a great deal of astigmatism. That's the skill set that one learns in this particular set. This is the wet lab or cataract portion of the Bioniko kit, and as you can see here, it's modular. We're going to put together the eye. You can see here this is the corneoscleral portion that is probably reusable a few times depending upon the structure of the wound. Here's the lens, and we want the shiny side to be anterior, and so we're going to take a look here and dry this off to look at which side is the dull side and which is the shiny side. So you can see it right here. Then we're going to go ahead and put the shiny side down. And you'll need your inserter instrument in order to dial this in. And you can see that here. We're going to go ahead and just rotate it in order to push that lens into the eye. And once it's secured, we'll go ahead and turn that over and then open the lids, which we have just wet a little bit with BSS, and pry them open in order to place this in. This is a different holder which has the ability to inject egg whites behind the lens to simulate vitreous coming forth in a broken capsule. And now you can see here creation of the para, injection of the viscoelastic, creation of the wound. This is a 2.4 millimeter corneal wound. The capsulorhexis, it's a little bit hard to see here, but through the microscope it's clear, so just creation of a little flap. And then bring that flap around with the capsulorhexis forceps, and you can see again here it's a little bit thick. However, we're able to flap that over and proceed in a tangential direction and go ahead and complete that curvilinear opening. And here it is here. And now, again, the ability to put the phaco tip inside the corneal wound is not so easy as it was the prior case, and so we're going to go ahead and open that wound and again use a second instrument to try to insert that phaco tip, which then goes in. And then this is just a sped up phaco. In this particular case, this is just simply a bowling out technique. A second instrument is then used to just make sure all those pieces are coming out and just delivered directly to the phaco. So I hope you've enjoyed this wet and dry lab presentation. Cataract surgery is a lot of fun, and I hope you enjoy your journey to becoming an accomplished surgeon. Practice makes perfect. Best of luck.